What is the definition of a vaccine?
So per the CDC, a vaccine is a preparation that is used to stimulate the body's immune response against disease. So vaccines are usually administered through a needle injection, but it could also be administered by mouth or via the nose.
And there's been a lot of discussion about that the mRNA vaccine is actually not a vaccine and doesn't line up with what the definition is.
So the mRNA vaccine is a vaccine because it does stimulate the body's immune system. And that's the goal of the vaccine, is to really get the body ready to identify and to fight the, whatever virus or disease it's recognizing.
So we've had vaccines for about 100 years. And what has been historically the normal length of time that it takes to safely produce a vaccine?
So historically, it takes about 7 years on average to develop a vaccine. We were very, very grateful that we were able to develop this vaccine so quickly. But we also want to remind people that the work did not just start when the pandemic began. There are actually other types of coronavirus, including SARS and MERS, which occurred, as early as 2003. And so back in 2003, we had scientists who were working on vaccine strategy related to the coronavirus. And so, putting that in perspective, that was almost 20 years ago. So we had a little bit of a head start in thinking about these things. And what's also different is that because this coronavirus strain impacted so many people worldwide, there was a huge collective interest and a huge mobilization of resources and scientists and sort of the smartest people across the world to develop this vaccine in sort of a unified goal. We do want to emphasize that, all of the safety precautions that are normally taken with vaccines were taken, and that, each of these vaccines that is approved in the United States had to go through the same hurdles to check to make sure that the vaccine doesn't cause too many adverse events, that it is safe, and that it also is effective in preventing infection and reducing hospitalization and death.
One of the questions that I hear a lot is that the mRNA vaccine has never been developed as a vaccine. The technology was developed for other purposes. Is it true that this is the first time the mRNA technology has been used on a vaccine?
So mRNA technology has actually been applied to, trying to develop other vaccines. So this is not the first time it's been attempted, but we would probably say this is probably the most successful demonstration of getting an mRNA vaccine to full production. mRNA technology has also been used in cancer treatment for years. So it's a very well accepted technology, with companies that have built, done all of their work based around this work. So again, it's a well-established technology that we were trying to use in vaccine development before, but that we were much more successful with the development for the COVID vaccine. So mRNA technology was used to develop a vaccine for the Zika virus, but we did not have a chance to fully use that.
So one of the concerns I've heard is that with all three of the vaccines, that they were developed using aborted baby stem cells as part of the process. Is that true?
For the vaccines, Johnson & Johnson is made using fetal cells. Not all vaccines are made using fetal cells. So for example, the mRNA vaccines do not contain any fetal cell material. Currently, some of the vaccines produced that we're receiving as part of our regular vaccine series can contain fetal cells. But again, these fetal cell lines go back decades ago. So it's nothing that was new or newly obtained. These were cells that were used, that were obtained, probably in the late 60s, maybe late 50s.
Can you explain what vaccine efficacy is?
So vaccine efficacy refers to, how well the body is sort of protected after getting a vaccine. So for instance, typically with any modern day vaccine, we would expect an efficacy rate greater than 50%. meaning that, for instance, if you got the flu shot and it were at least 50% effective, that half the time that you're exposed to the flu, that you wouldn't actually get it. Now, with the COVID vaccines, we've tried to make sure that the efficacy rate is high. That is why 2 doses are recommended for Pfizer and Moderna, and that's also the reason why an additional vaccine dose is recommended for those who are moderately to severely immunocompromised. So with each successive dose, there's a higher rate or higher level of vaccine efficacy.
And does that mean that if it's 90% efficacy that you won't get sick?
So, it does mean that you are very well protected, but 90% of efficacy also means there's a 10% chance that you may contract and develop the infection.
So are mRNA vaccines as effective as traditional vaccines?
Yes. So, compared to traditional vaccines, mRNA vaccines actually generate a stronger type of immune response. They kind of do a double whammy for for the COVID vaccine. So they make antibodies and it stimulates the immune system's killer cells. So it's really like a double strike against the virus.
Now, is there a trend in those who are fully vaccinated and die from COVID or require ICU treatment?
So we actually see quite the opposite. The vast majority of hospitalized individuals with COVID are unvaccinated or undervaccinated. So in Riverside County, that's about 90% of all those hospitalized with COVID have not been vaccinated or fully vaccinated. And then if you look at the COVID-related deaths during this calendar year in Riverside County, approximately 97% of those deaths have occurred in people who have not been vaccinated. So overwhelmingly, what we see is the vaccine is highly protective and decreases the likelihood for people to be hospitalized or to die from COVID. So quite the opposite.
Is it true that the Pfizer COVID-19 vaccine was not fully approved by the FDA? Is it only partially approved?
So the FDA approved the Pfizer vaccine for 16 and over with full approval, so not EUA or not emergency use authorization, on August 23rd of 2021. For the 12 to 15-year-olds, that's still under EUA approval or emergency use authorization while they're finishing up the studies. And we are anticipating that that will also receive full FDA approval at some point in the near future.
So one question I hear a lot is, why should I get a vaccine that hasn't been around long enough to know the long-term effects of it?
I think that's a great question. So, when the vaccine first came out, we were, us in the medical community and myself as a physician thought it was great because it's kind of a pathway out of the pandemic, right? And I was thinking, well, I don't want to get COVID because I don't want to pass it on to my friends, my family, my patients. So I know that this is a new vaccine, and it was when it was getting ready to roll out. We were all excited because we could see a light at the end of the tunnel. But at the same time, we wanted, to make sure, for myself at least, I wanted to look at the literature to see how was this vaccine developed, what was the process, what is the data behind this vaccine. And, because we're nervous too, right? Because it was developed a little bit faster than the way we would normally see vaccines developed. But again, it was developed during a pandemic by very smart people using technology that had been in development. So it's not completely new technology. It was just applied to a vaccine that we needed sooner due to the pandemic. So I remember reading the FDA approval for the Pfizer vaccine, and it came out on December 11th, 2020. And in it was amazing that they enrolled over 37,000 participants in the trial. It was a really large and well done trial. And following that, they saw that it had 95% efficacy in preventing COVID-19. And that's what resulted in the emergency use authorization because of that high efficacy. And so when I read that, that convinced me that this vaccine was safe and it was effective. And, it gave me a lot of hope thinking that I could get one of those vaccines. And so after I got the vaccine, I was very relieved because I felt like this will protect me and be able to continue to serve my patients and protect me against, giving COVID to my family and loved ones. Currently, 90% of the patients admitted for COVID in Riverside County, as Dr. Leung said, are unvaccinated or partially vaccinated. And we can see from our own data that the vaccines work to protect vaccinated individuals in Riverside County from severe illness and death from COVID-19.
What makes this vaccine so special that everybody needs to get it in America, whereas not everyone gets the flu vaccine every year? What makes this special?
So I would actually encourage everyone to get the flu vaccine. So, I think, if we were thinking about how we can protect patients or how we can protect ourselves and our loved ones against severe illness, and that does include flu, is our recommendation is that, for the flu vaccine, we currently recommend it annually. So as a physician, I recommend it annually. For COVID, because we're in a pandemic, we've seen that it's caused a lot of mortality. We've had over 600,000 deaths in the United States from COVID. And here in Riverside County, we've had also a large number of deaths that could have been avoidable with the vaccine. So especially in a pandemic situation, getting this vaccine will help prevent severe illness and death. In the United States so far, we've already vaccinated over 375 million people. And that has actually, helped us in many ways in reducing, the number of patients that are coming into the hospital with severe illness. And so as we think about this year in particular, last year and this year, and likely this winter, it's really important that we get this vaccine in order to prevent illness for ourselves, our loved ones, our friends, our family.
What medical conditions just should not get the vaccine?
So there are very few situations in which someone should not get the vaccine at that moment. For instance, if someone is acutely ill with an infection, if they have COVID right now, if they're having cough or again, an infectious condition at this moment, they should probably wait until that acute phase is over. Really, for everybody else, there are not any medical conditions that we would say, if you have this, you should not get the vaccine. Sometimes we do hear patients and individuals who say, I did not get the vaccine because I'm pregnant, or I did not get the vaccine because I have diabetes, or because, I am getting treated for cancer. But really, the evidence suggests quite the opposite. And the CDC has come out with very strong recommendations that, in each of these situations, people with medical conditions, people who are pregnant, people who have cancer, and who are getting treatment, these individuals are probably at even greater risk for developing complications if they get COVID. So having underlying medical conditions is usually an even greater reason for getting vaccinated.
If a person has a negative reaction to other vaccines, should they not get this vaccine? And if so, what would be that level of reaction, negative reaction, that would disqualify them, or whereas you would recommend that they not get this vaccine?
That's a great question. So normally what we would ask is what kind of reactions they've had to the vaccines in the past, and if they had any particular allergies. And so, depending on the response, we'll look and see if any of the allergies might be within the materials that were used to develop these vaccines. So usually what we say is none, unless there's a severe allergic reaction in the past, or if they have a specific allergy to one of the contents or materials that was used to make the vaccine. We do know that some people may have a mild allergy or even moderate allergy or allergic reaction, and we still recommend that they go ahead and get the vaccine, but undergo a longer monitoring process to make sure that they're okay after they receive the vaccine.
Okay, one of the big questions that we get, or we hear a lot about is can you clarify the risks in receiving the vaccine and its impact on pregnancy, delivery, infant immunity, and breastfeeding?
So, first of all, there are many registries that track side effects and outcomes in pregnant women. We, based on the data that has been collected so far over the past year, which is fairly robust, it does not look like there are any increased risks for pregnant women or for the unborn child. Quite the opposite. We do see, significant advantages or benefits for vaccinating our pregnant moms or our breastfeeding moms. We do know that, a pregnant mom who develops COVID has a higher chance for having preterm labor. So a vaccine, can potentially help prevent that. We also know that for breastfeeding moms, that the antibodies do show up in the breast milk. Now, whether it's protective, we do not have large, scale data right as of yet to know whether babies who, take that type of breast milk are more protected, but that is sort of the guess because we see it showing up in the breast milk, like antibodies to other infections. And then, we believe that could potentially provide some immunity for the baby, for the newborn child. That would be very similar to kind of what we know of other infections when moms are either vaccinated or have active levels of antibodies that are being transferred through the breast milk.
How safe is the vaccine for a cancer patient that is weak in terms of side effects?
I think it's actually very important for our cancer patients to receive the vaccine. One of the things that we know with cancer patients is they're receiving, they could receive chemotherapy or radiation, which can weaken the immune system. And so receiving the vaccine will actually help protect them against serious illness from COVID-19 because they are more susceptible to serious illness because of the weakened immune system. And so if you have cancer and you're undergoing chemotherapy or radiation or treatment, you may actually need a third dose to help get your immunity to the level where it will protect you against COVID-19 after receiving the vaccines.
If I get the vaccine, what underlying pre-existing conditions make me susceptible for severe illness if I am infected by the Delta variant?
So in general, chronic medical conditions, especially those that might affect, the lungs or sort of the respiratory system, as well as those chronic conditions that might affect, the immune system or the body's ability to fight off infection, those could place individuals at particular risk. However, we do see that in general, the more chronic medical conditions that people have, whether it is diabetes or heart disease or, kidney disease, that any of those chronic conditions really does increase the likelihood of complications or the likelihood of hospitalization. So especially for people who are taking medicines, who are getting treated for, chronic conditions, we highly encourage the vaccine.
What we know is we have heard that there are some negative reactions to the vaccine and that have been publicized on the news. I've heard about blood clots. I believe it's an inflamed heart, paralysis. So can you give the statistics on what are the chances that if you get the vaccine that you could acquire one of these side effects? And is there a difference between the different vaccine manufacturers and which side effect you could get?
Right. So, in the United States, we're really lucky. We have a really robust registry looking at adverse events with vaccines. And then we have vaccine safety experts then reviewing the data to help us better understand, any trending that we might be seeing. So if you remember, Johnson & Johnson back in April did pause the vaccine because they were looking at specifically, thrombocytopenia syndrome with thrombosis, meaning the blood clots that you're referring to. And they did find that the Johnson & Johnson vaccine did have a small increased risk, although very rare, of getting TTS or that blood clot condition, especially in women under 50. So when they looked at the data, it looked like there was 45 confirmed reports out of the 14.3 million doses that were administered. So, if we have to keep that in context to the large number of vaccines that were given and the very small but rare side effect of the vaccine, which was the TTS, or thrombocytopenia syndrome. After April, they unpaused the Johnson & Johnson or the Janssen vaccine to allow it to be continued to administered, but with the safety warning that if you are a woman under 50, if there's another COVID vaccine available, to consider that with your provider to see what the safety profile might be for that particular person. The other side effect that was discussed recently was also around Guillain-Barré syndrome, and that's the paralysis that can be seen with certain vaccines. And that one is also associated with our COVID vaccines, and in particular Johnson & Johnson. So, again, keeping that in context, there's been 185 preliminary reports of Guillain-Barré syndrome in our vaccine adverse events reporting system as of September 1st. And so, if you keep that in context of 14.3 million doses, again, that is a very small, very rare, but a known, adverse effect of our vaccines. So the CDC is continuing to monitor this and trying to see, if there's any additional trending there. They're also looking at tracking the inflamed heart disease issues that you might be hearing about in the news, or the myocarditis, following administration of the mRNA vaccines, which is the Pfizer or the Moderna vaccine. And, as of September 1st, from the data, we see that there's 1,404 reports of myocarditis or pericarditis among people ages 30 and younger who received the COVID vaccine. And there was a confirmed 817 cases out of the 370 million doses so far. So if you think about that, if you again put that into context as to how many vaccines we've given to date, 375 million doses, and of that 817 cases, that's again, not insignificant, because that is something that we want to track and make sure we address early and alert our medical community to look for that. But at the same time, it is a small and rare possibility after receiving the vaccine. So based on that information, the CDC and the Advisory Committee on Immunization Practices concluded that the benefits of the COVID-19 vaccines currently in preventing the illness and severe, illness and death in associated hospitalizations and ICUs, it outweighs the rare risks of those side effects.
I've heard that people who have had COVID-19 and then they get the vaccine lose their body's natural immunity to it. Is that true?
So we are still learning about, how quickly the body loses its ability to fight off infection, both after a vaccine or a natural infection. What we do know is that with a natural infection, antibody levels stay high for at least 3 months, which is why we've used the 90-day guideline in the past. We also know that with the vaccine, antibody levels stay at a high level for at least 6 months. We think that the antibody levels start to fall after that point. However, the body has other types of immune functions in place that can continue to identify and fight off infections. And those are harder to measure and harder to track. So it's very possible that someone who's had a vaccine or had an infection would continue to have some protection even beyond the time that the antibody levels fall. So at this point, we're still learning, but if you're just watching the antibody levels, we know that they start to fall probably a few to several months after a natural infection or a vaccine. So just to clarify, for people who've had an active infection, we still do recommend getting the full vaccination series. And recently, the CDC published a study from Kentucky that showed that for people who've had a natural infection, compared to those who've had the vaccination, people with a natural infection have over twice the risk for developing another infection compared to people who've been fully vaccinated but haven't been infected before. So, even in people who've had the infection before, we believe the vaccine has incremental and additional benefit.
So I've heard that thousands of people are dying after taking the vaccine. Is that true?
So there's no evidence from the World Health Organization or from the CDC's tracking of adverse events that's true. So what we're seeing is that, the vaccines are actually very protective. So it's opposite of the statement that thousands of people are dying after taking the vaccine. So again, if you remember, we've had 375 million doses administered. And, the number of deaths that we've seen are more related to our unvaccinated patients. And we've seen that through our data here at Riverside County as well. If we look at our hospitalized patients and our patients dying from COVID-19, over 90% are unvaccinated or partially vaccinated. The vaccine itself is very safe. It's being tracked. Any deaths related to the COVID vaccine can be reported to VAERS. And actually, as a physician, we do report that to the vaccine adverse events system. And then they're looked at and reviewed through a secondary review process where they pull the records to look and see if there's a relationship between the vaccine and the death that has occurred. And to date, there hasn't been a causal relationship established.
So there's been a lot made on social networking and on news programs about the CDC VAERS database. And that is one fact that likes to be thrown out by people who don't want to get the vaccine, is that this database they've documented, thousands of deaths, tens of thousands of serious health problems in patients after receiving the COVID-19 vaccine. And why isn't the medical community talking about this?
So, just to clarify, the VAERS database for COVID is really remarkable. It allows us to capture any potential side effect or adverse event related to the COVID infection. It's very easy to report. However, what we want to remind people of is just because something is reported into the system doesn't mean that it's actually related to the vaccine. And for instance, if you just follow a normal population over time, you'll have a certain number of people who will have different types of symptoms. You'll have people dying from natural deaths. With the VAERS system, there have been over 7,000 reports of deaths occurring after someone's had a vaccine. But when we've actually done the analysis and looked at, does it look like the vaccine is actually the cause of death for those people? We have not yet found a link. And then we also need to compare that with the fact that, we've had well over 600,000 COVID-related deaths in the United States. And that's compared to, over 7,000 reports of deaths happening. But you also need to, again, sort of remove what the natural baseline of deaths would be even without a COVID vaccine. And so once you do that, there really is a very compelling argument that, the vaccine probably saves many, many more lives than potentially, impacts people negatively.
So I know that the VAERS database is just one of the databases tracking COVID-19 vaccine adverse events. So can you tell us a little bit about the VSafe database?
So the VSafe is the patient-facing way to report any vaccine adverse events. And it actually feeds directly into VAERS. So, we actually really encourage our patients there's a nice QR code, they can scan it on their phone so that we can track any potential side effects. As a provider, I want to make sure my patients have scanned that so that they can track that forward. And the VSafe system is really nice because you can enter for that day the next day, and then they'll track you forward over a series of time so that we can get data regarding how that particular patient has done with the vaccine over a period of time. And all that data then gets aggregated into the VAERS system.
So the CDC states that it is false that a vaccine can cause you to become magnetic. But what we see on social media, YouTube and TikTok is that there's lots of people who are showing that their body is actually magnetic, and they stick metal utensils to their injection site. Do we know what the cause of that is? And is there any long-term side effect or any reason to be concerned?
Right. So there's no metal within the vaccines, and it does not cause a person to become magnetic. So with over 375 million doses, we would have seen if there was some issues around that. So no, that there's nothing in there that would cause you to be magnetic.
Can you explain why there's all the social media videos and how that works? How's that happening? Are they just conning us?
Just like what we were talking about with deaths, sometimes we're looking at a possible cause of that. And so I don't know if there was something else that was happening somewhere that sparked that particular item. But currently what we see in the vaccines is that there's not anything within there that would cause a person to become metallic or to become magnetic.
Okay, and a corresponding question to that is there microchips in the vaccine, and is it possible that it's those microchips that are magnetic that are then attracting or allowing metal to stick to the injection site?
So no, there's no microchips in the vaccine. If you think about how a vaccine is made, there's not a way to, the microchips that we're talking about that, are pretty bulky items, and there's no microchips.
Dr. Tsang, I know that you have a couple of young children, and at the point that they are able to be vaccinated, and let's assume that all 3 vaccines were approved to use on them, which one would you choose to have your children get, and why?
So I would give them whatever comes out first. So if the first one is Pfizer, I would give my children Pfizer. So, the reason why is because I want them to get the protection as soon as they can. My children are 7 and 11, so they don't qualify currently based on the age to receive any vaccine. And so once an approval is given for that age range, I will give them whichever one is available so that they can become protected against COVID-19, especially now that they're in school. And we do know that, there's transmission occurring in the schools. And even though they're using a layer of safety, trying to, they keep their masks on very well and they socially distance, there's still risks being in, in an environment like school. And so, whatever comes first is what I will vaccinate my children with. Again, we encourage everyone to continue to get vaccinated if you haven't been vaccinated yet. If you've recovered from COVID, we highly encourage you to go get vaccinated ahead of the winter season. We do know, based on our data here in Riverside County, that the vaccines will protect you and your loved ones against serious complications from the virus. So to get vaccinated, you can go to myturn.ca.gov. That's myturn.ca.gov, and that will take you to sites that are close to your home that's convenient for you to get vaccinated.